Hi, I'm Chung, Chief Medical Executive at Children's Health and UT Southwestern Medical Center. Welcome to the In the Know video series. Here with us today, Dr. Tamra Slone, who is an associate professor in the Department of Pediatrics at UT Southwestern and medical director of Hem-Onc program at Plano campus. Welcome.
Thank you so much, Dr. Chung.
I'm looking forward to this talk.
Yes, I'm happy to be here.
Right, and I want to talk about precision medicine. There's a lot of rhetoric and talk about what that really is. What does it mean in your program?
Precision medicine is essential in hematology and oncology care. And an example of that is in our leukemia program. Children with leukemia are not all the same. We understand each child's leukemia so we can treat their leukemia the best. A perfect example of that is risk stratification in leukemia. So there's a lot of factors that go into prognosis and what we need to do to treat each child. But also what has been nice in collaboration with UT Southwestern is we do next generation sequencing and really look at all those genetic factors that are playing a role in prognosis and also can be targeted. And so we can do additional therapy. In addition to that, we look at the response to chemotherapy. And when you combine those clinical factors, the genetic factors, and the response to chemotherapy, you can really individualize the care for each child.
Speaking of cutting edge, I wonder if you can kind of elaborate on the sort of a newly developed monoclonal antibody against the ALL.
Yes, we're very excited. We have a new medication, a newer medication. It's immunotherapy called blinatumomab. This immunotherapy works by attaching to the leukemia cells and attaching to their T cells and activating their own immune system to attack the leukemia. It's very interesting. But we did a clinical trial where we added 2 blocks or 28-day blocks of the blinatumomab to their conventional chemotherapy, which is about 2.5 to 3 years long. And what happened was that the study closed early this summer. The outcome was such an improvement that it was stopped early. And so now it's considered standard of care.
That's great.
And it's an amazing improvement in the cure of ALL. And so we continue to strive for that 100% cure rate, and we are well on our way with the addition of blinatumomab.
Well, that, as well as many great treatment that you're providing, what has the Joint Pediatric Enterprise meant to building such an offering up there in Plano?
We're very excited about the expansion of the Pauline Allen Gill Center for Cancer and Blood Disorders. This is a project that began many years ago with a collaboration between UT Southwestern and Children's Health. The thought being that the population is growing and we wanted to be able to expand our services and provide cutting-edge care closer to home. So really having one program, 2 campuses. The physicians are really the same physicians. They're national leaders in the different areas and diseases that we specialize in. And it's the same physicians that work in Plano and work in Dallas. We also have expanded all of our other services that are really important for hematology and oncology. And that would be having surgery, surgical care, and the radiology and pathology and all those services that we use. But in addition to that, having those family and child support services. We have hematology, oncology, social workers, and child life specialists, and psychologists, and play therapists, and really develop the multidisciplinary approach that we have in Dallas and mirrored it in Plano. So we're really excited. Our ability to do clinical research is important for hematology, oncology in Plano as well. And so I'm really proud that we've been able to build an investigational pharmacy and lab and really the infrastructure so that we can do those clinical trials on the Plano campus as well. It's really essential for our care.
You've done an amazing job, and your team members. I mean, in just 5 years, I wonder if you can kind of help the audience to sort of get a fuller context as to how far the program has transformed in just a matter of 4 or 5 years.
We've expanded our outpatient care, really tripled the amount of patients that we've seen in the last 5 years. And our inpatient services went to now having a robust hematology oncology inpatient service We take care of those children. And so families do get the benefit of that, where if their child has to be, unfortunately, in the hospital for a month, and this is an hour and a half closer to home, that's a tremendous benefit for them. Really have that community approach, but still get all the same care.
Well, and as you said earlier, with one team,
Right.
Both campuses delivering a really
Correct.
consistent, high quality care.
Yeah.
The Plano Tower opening, how's that impacted?
The new Plano Tower just in itself is really important as we continue to grow. Having those modalities like the PET scanner and availability for CT scanners and MRIs and surgical services, we've really mainstreamed everything where they can get into the clinic really quickly so we can see them same day, next day, whatever needs to be done for that child, and really have built a strong team with nursing and others who help in that and talk to families and make sure they know what to expect. And I think that new patient process has been a tremendous improvement. So for families, yes, you can be closer to home, but you get the expertise and you get the opportunity for clinical trials. Really, clinical trials are an essential part of hematology oncology care.
Right.
Almost 90% of our patients will enroll on a clinical trial. And that's a really important thing because that's how we've gotten to where we are. If you look at leukemia care in the 1960s, the cure rate for leukemia was less than 20%. Well, now it's over 85%. Yeah. So we flipped that, and that's through clinical trials. For families, it is important that their child has the opportunity for those cutting edge treatments, but also that they know they're contributing to the future children with that diagnosis.
Well, that's great. And I think with something like Joint Pediatric Enterprise, with the partnership between UT Southwestern and Children's Health is really what makes it possible for a program like yours.
When this started 5 years ago, it really was the perfect example of the collaboration between Children's Health and UT Southwestern. And from the very beginning, the leaders in our division had a vision for expanding our program. We had Children's Health and UT Southwestern at the table, and that collaboration has made this a reality in such a short period.
Thank you for all the great work that you do for UT Southwestern Children's Health.
Thank you.